chronic inflammation is some kind of thing we check as part of a disease process, like infection, like autoimmune, right? We can look at some blood markers, C-reactive protein, for example. But it turns out that most of aging is the rate of chronic inflammation. Because if you look at two 70-year-olds, one may look youthful and be more active and have more energy, and one may be sedentary and have aches and pains and gray hair, but they were both born on the same date. Why is one person looking and feeling older than the other? Because they aged more rapidly on a biological scale because they have more chronic inflammation. Not necessarily having disease, but chronic inflammation slowly accumulating in their cells. Maybe they didn't have a quality diet. Maybe they were stressed their whole life and never slept, like when you were a resident and I was a resident. Maybe there are other factors. Maybe they're exposed to, they live near a power station, they have electromagnetic fields. Who knows what's doing it, but it could be any of these things. And the faster and more chronic inflammation you're exposed to, the more likely you have disease. There are wonderful evidence-based medicine on these topics, okay? The less inflammation you have, the slower you will age biologically, the slower you will develop diseases. So it becomes clear that chronic inflammation is aging. And someone used this great term, I wish I could take credit for it, inflammaging. You may have heard that, inflammaging. So the slower you can, the less area under the curve of time and inflammation, the longer you will have a healthier life, that you'll have a better health span. So anything you can do to suppress that inflammation, eating well, sleeping well, exercising, meditating, flexibility, yoga, other practices, all these things contribute to your longevity